So, tonight, as promised, a new subject. But first, remember, this is only education. If you have a problem, please see your own practitioner or your doctor to get advice. I'm here to educate. That's it. So, what is it? Drum roll, please. The Wim Hof method. Has anybody heard of Wim Hof? He's a gentleman from Holland who, for many decades, has had a fascination with the cold and breathing. And over his decades, he has mastered this technique of reducing inflammation in our bodies that correlates with a variety of scientifically proven in universities health parameters. You get weight loss, you get more energy production, you get increased circulation to your digits, your fingers and your toes, you get more energy, you get better sleep. And it also helps malady of complaints. You pick any complaint that you're taking medications for, and almost certainly there will be an inflammatory component to that. So this is what this amazing technique does. So you can easily Google him, check him out, watch some videos. But today I'm going to introduce what I've been teaching my patients for the last month or so. And the only reason I'm doing this is because I've done it myself. I had to embrace the fear of a cold shower, because I hated it, and implement into my lifestyle on a regular daily basis. And I'm making leaps and bounds forward with the one lasting medical complaint that I have, which is Raynaud's, which is white fingers. That came on, interestingly, about 3 years ago in a cold shower, because I was trying this cold shower thing. And because I wasn't doing the breathing, my fingers were white. And that was the digital arteries. These are the arteries, there's one in each side of your fingers, making it way up to the tip. Only one artery that branches into smaller arteries or arterioles to give oxygenated blood and nutrition to the tissues and the cells. So these arteries go spasmodic with me, they close down, I get white fingers, which freaked me out for a long time. But I can honestly say now, I can do a cold shower for up to 5 minutes. And I mean freezing shower for up to 5 minutes. And my fingers stay pink because of the breathing component. Okay, so give you a little bit of a history of the science, my personal journey with this, and now what do you do? So this is what I suggest. This is what I've been suggesting for the last few weeks for people interested. Remember, this is a free treatment that works, has been shown to take people's inflammatory diseases away, like inflammatory bowel disease, like chronic pain. It's completely amazing. So, first thing, in the shower, whatever temperature you like, I recommend at the end, you start some breathing exercise and you turn the temperature down a notch. I think there's about 5 temperatures of water after your particular choice of temperature of shower. So say you're having a roasting shower or a very warm shower, you're going to turn it down to cooler. And then you can go to cool. Ooh, it's cool. Then you go to cold. Ooh, this is cold. Then you go to very cold. You won't like that. And then it's freezing. Crazy stuff. But only in time, take your time with it. I've been doing this cold shower thing for quite a while now. So I've built up to this measure of 5 minutes. So the breathing is this. You inhale through your nose and you exhale through your mouth. So on the exhale, it's longer, okay? And you do this during the cooler shower. If you're brave, go to cold or a cool shower, but you don't need to do that first of all, just maybe 1 minute. So you got the cold exposure daily. Second, breathing. Another technique to be done when you're sitting down at your rest or lying down in the bed. And this is what you do. You breathe in through your nose, expand those lungs, so large inhale, and then you exhale briefly. 30 times. Now, if you're doing it right, you will tingle. Maybe your head, maybe your body. You want that to be happening, and you want to have a sensation that is super oxygenation of your tissues, which just means more oxygen than you're getting, and as a result, you will start to learn how to use oxygen better. So after the 30, big inhalation with small exhalation, you do a full breath in and a full breath out, and then you hold your breath. So holding your breath is important because you need to measure how you're getting on with this. So if you start and just do maybe 30 seconds hold breath or 40 seconds, maybe longer if you've been doing it in the past. So you've done the 30 breaths, you've done the full inhalation, you do full exhalation, and then you hold your breath. Monitor it, record it. And so every week, just record the duration of the holding breath. So what happens here is there's a stimulation of oxygen use in the cells. And the reason you know it's working is as the weeks go on, if you can hold your breath longer and longer and longer, it just means that the oxygen that you are inhaling is working more efficiently. And it's the combination of the cold exposure and the breathing with commitment, because commitment is the third aspect of this method, commitment on a daily basis. So if you want to read up on this, you could read his book called The Iceman. I read that recently twice to get the background for this new adventure for me and new adventure for patients. And what people are saying so far, it works. They feel better. They can't stand hot showers anymore. They feel relaxed. Somebody said today, I feel relaxed. I thought, oh yeah, that'll do it. Because you're relaxing the brain, you're relaxing the body through the stimulation of the skin through cold exposure. And I think that's how it works. So, thoughts, comments, ideas, please. What do you want me to talk about on this? I'll certainly be sharing my stories as well as other people's stories on this if they want. And I just think strongly encourage it. And I think I'll maybe deal with the fear of this, because I had to face that myself for several years, especially with white fingers and poor circulation, which is getting better, by the way. So there you go. That's the video for today. I hope you liked this, and I'm super excited to have a fourth mainstream treatment in my practice that is making a difference in people's lives. So thanks so much. Have a good evening, and we'll see you next week.